Hello, welcome to Health System. This presentation is about the types of health systems in the world. There are about 200 countries in the world, and these countries you can see from North America we have Canada, US, we have big countries like Brazil. In Latin America, you go to Africa, we have about almost 46, over 46, 50 countries. We have Europe, we have Russia, and we have Australia. And these are the maps of 198 countries around the world. However, all these 198 countries can be categorized into four key health systems. And these are the social health insurance or the Bismarck model, the centralized or the state control model, the national health insurance model, and the national health insurance model. Just be clear about it. There are two types of national health insurance model. We have the national health system basically operated by the UK or the United Kingdom, and you have the national health insurance schemes which are operated by many countries around the world. Then the last one is the pluralist model, and the pluralist model basically combines out-of-pocket payments with national programs. So now let's come to the social health insurance model. Okay, first, the social health insurance model originated from Germany in 1883 and Bismarck, and currently is operated in many countries, mostly European countries and other developed countries like Israel and Japan. Okay, what are the key features of this social health insurance model? Basically, social health insurance model is a system of taking care of individuals, taking care of patients or people without insurance through employers and employees. So the system works in this way. Employers have to cover their employees, and if they are not covering their employees, they have to pay into a common pot. So these are the key features of this system. There's always is a universal access system, so there is always protection against risk, in the sense that if you are sick, you have to get access regardless of whether you have money or not. You have to get access to health services. They also have what is called the sickness funds, and these are key payers, or what they are also referred to as purchases. And these are the funds, non-profit funds, whereby employers pay into a system, and the funds discover people without insurance or low-income families. And in this system today, there's a lot of solidarity in the population, in the sense that there's need for expanded coverage, and we have so many actors as part of this system. But what is interesting is that this system is based upon cooperative model, and under any kind of cooperative system, we have the labor, business, and of course government coming together to negotiate for bills, to negotiate for prescription, the cost of prescription drugs, and other coverages and other costs of the health system. Then there's also the issue of participation in governance. We have all these key actors: government, business, and of course the private sector playing important part in this health system. And finally, we have individual choice of providers and sickness fund. So as an individual, you have universal access, but what is also important is that you have a choice. You can choose whichever provider that you want to have services from, as well as the sickness funds, or what is called the financiers or the payers. And in a country like Germany, they have about 240 sickness ones covering all sorts of health services. You can read more about these health systems through this link. Okay, so let's specifically look at Germany and some of the specific aspects of their health system. And of course, Germany is basically associated with this social insurance model. And at this point in time, Germany spends about 10.7% of its GDP on healthcare, and we have a premium of about 750 per month in dollars, and it's called, the system is means tested. What it means is that your it depends on your ability to pay, so the amount of premium that you pay each month depends on the income and your income level. The main type of health system, as I said earlier, is usually referred to as the social health insurance model. And how does it operate? It operates as a single payer system, in the sense that the funds that provide the money and everything for the healthcare system. Okay. Let's also look at the issue of Japan. Japan spends about 8% of its GDP on healthcare, and it pays, the premium is about $280 per month, and most of them are paid. This, as I said, is a social insurance system, so the employers usually pay this amount on behalf of the employees. And it's also a single payer system, and of course, as a single payer system, there are so many concerns with such a system. We have low expenditure on healthcare, we have many hospitals, and of course, the big one is the unlimited utilization of health services. Switzerland, which was some time ago was like the US, also operates a social health insurance system, and at this point it spends about 11.6% of its GDP on health services and healthcare, and it also has this social insurance system. But keep in mind, it is the second expensive health systems in the world. Okay. Now let's look at what the centralized or the state control model is about. First, note that it originated from Russia in 1917, and of course 1917 is when the Russian Revolution occurred and communism was introduced in the country. And its main features is that it has universal coverage, it has universal access, and it has a single payer system. Of course, the government is in charge of all apparatus of the state, so it's not surprising that the government is a single payer and everybody in the country has access to health services. However, currently, with the collapse of communism in the 1990s, this system is basically operated in only Cuba and North Korea. Okay, the second system, or the third system, is the national health insurance model. And what is this model about? What are its key features? In this system, we have the government providing the funding, but the delivery of health services is through the private sector. So we have statutory insurance in the country, so there's a universal access. Everybody has access to health services. The system is usually administered through government, which is basically the payer or the purchaser, and of course the delivery is through the private sector. There's also the issue of funding. Most the the national health insurance system is basically funded through taxes and of course mandates. So when you compare it to the social health insurance system, where it's basically funded through employers and employees through payroll deductions. For the national health insurance model is usually through taxes and of course mandates. Okay. There are two types of the national health insurance model. The first type is called the beverage model, or the British National Health Services Scheme, and basically it originated from the UK in 1948. In 1948, the other system is called the National Health Insurance, and the National Health Insurance is currently operated in countries like Australia, Canada, South Africa, South Korea, and Taiwan. So what are the difference between these two types of national health insurance models? The beverage model, in the beverage model, or what is the National Health Services Scheme of UK, the government controls everything, both the delivery and the payment of health services. And in this case, even under that system, physicians are employees of the government. Keep in mind, not all physicians, there are other physicians that work in the private sector. And compare that one to the pure national health insurance schemes, where we have the government controlling the funding but delivering services through the private sector. So let's take an example, Canada. In Canada, each year we have the government coming up with what is called global budget, in the sense that the government allocate huge chunk of money to cover health services, and the government negotiate with the private sector on fees, on charges, cost of prescription drugs, and stuff like that. Okay, so let's look at some of the details of the beverage model, which operates in UK. Over there, because it's basically funded through taxation, there's no premium. So if you're in the UK, you're sick, you go to the hospital, you don't get any bill. Who doesn't like that? But most of the cost is through taxation. Okay. And because everything is funded through taxation, it's usually called a socialized medicine. So if you hear of socialized medicine, it's basically the UK system. And because the government control both the cost, the delivery of health services, there's always a low administrative cost. Just because we have gatekeeping in UK, which is very important, because physicians or healthcare providers are rewarded for preventing diseases, and that's very important. You have to keep that one in mind. But like any health system, it also has its own problem, and mostly it's associated with long waiting lines. Okay, let's look at Taiwan, which operates the national health insurance system, which is another version of the national health insurance model. It spends 6.3% of its GDP, 6.3% of its GDP on health services. It has premium, which is $650 a year for a family of 4, and the main type of health system is called the national health insurance system. And what is fascinating about Taiwan is that it has what is called the smart cards, and the smart cards is like a credit card whereby each individual has all his or her health information on one card, and you can just access it at anywhere, and the physicians will be able to determine the number of visits, the type of medication, just by swapping this marker. Of course, there's also issues with they also have issues with their own health system. We have low revenue, and of course, it's funded through the government. So we have issue of parliament approval of funds, which is the issue of politics. So the cost of the health system also keeps going up. Okay. Finally, let's look at the pluralist system. Okay. The pluralist system, as I said, combines out-of-pocket with government programs. And in the pluralist system, there is no universal access to health services. So keep in mind, let's give you an example. In most developing countries and in most poor countries, you visit your physician, the physician charges you, you pay your physician, and that's it. So if you are sick and you don't have money, you cannot visit hospital. That's it. Pure out-of-pocket system. But in most countries, government combines this out-of-pocket with so many government programs. And basically, the system is administered through both government and the private sector. And in most cases, we have the funding through private sources. So that's individual out-of-pocket monies, philanthropy, and all other sources of private funding. There's also issues of taxation. So some of the government programs are funded through taxes, and there's also the issue of mandate, where there is legal requirement that certain category of people are covered under the system. And the pluralist model, a typical example is the US, where you have most people get their health services through the private sector, mostly through employers. At the same time, too, we have government programs which operates like any national health insurance program. Example, we have Medicaid. Anybody who becomes 65 automatically qualifies for Medicaid, and it operates like a universal health system. We have the Department of Defense that also operates the Veteran Affairs and other programs, which is like the universal health system. We have the Indian health system, which is also another form of national health insurance coverage. As long as you are an Indian, a Native American, you are qualified under the Indian health system. So it combines, it's a typical situation for the pluralist model that combines out-of-pocket individual going for fee-for-service, and we have other government programs covering other different categories of people. But what is interesting in this pluralist model is that there is no universal access to health services, in the sense that in this system, if you are sick and you don't have insurance, you are on your own. And however, in a country like US, there are some protection built into the system. For example, you are sick, you don't have insurance, you can still show up at the emergency room, which is ER, and you cannot turn the hospital cannot turn you away, and it will be against the law for turning any person who shows up in the ER, or for not having services for any person who shows up in the ER. So basically, these are the four major types of the health systems in the world, and within these four health systems, there are variations across all these 200 countries in the world, but most invariably you can fit each country in the world in these four categories. And just to reiterate the type of health systems in the world, you have the social insurance model, where you have the system funded mostly by employers and employees through payroll deductions. You have the centralized or the state system where the government controls everything. Everything is in the hands of the state. The government is both the provider and, of course, the payer of for health services. And we have the national health insurance model. And keep in mind, as I said earlier, we have two types of national health insurance model. We have the national health services system or scheme, which is basically operated in the UK, where you have the government also literally controlling both the payment and the delivery of health services, and the system is funded through taxes. But what is interesting about the national health services system is that nobody receives bill because the system is basically funded through taxes. Then we have the national health insurance schemes, which is most common around the world, and basically is operated in countries like Canada, where you have the government providing the financing of health services, but the delivery is through the private sector. And also, this system, like any national health insurance system, is funded through taxes. Then the last one is the pluralist system, and the pluralist system combines both government programs and out-of-pocket payments. But what is differentiating the pluralist system from all the other three is that there is no universal access to health services. Thank you very much, and hopefully this presentation helps you to differentiate between the various health systems in the world and how to compartmentalize or categorize any country in the world. Thank you very much.